So let's talk about something that most people do not like to talk about, and that is constipation after surgeries. That is a very common thing that happens after any surgery you have. And it's a combination of people are not very active afterwards, they're not moving around quite as much, they're not eating or drinking like they typically do, and narcotics in general, the prescriptions we give you for the anesthesia as well as for pain medication, that's a big constipator for people. And it can be really uncomfortable for some people post-operatively if they're having issues with constipation and bloating and things like that. So what do we do to help prevent or diminish constipation for people? First and foremost, you get off the narcotic pain medication as soon as you can. That is the big constipator for you. So as soon as pain's not too bad, you transition just over-the-counter Tylenol. That will eliminate the factor that's contributing to the constipation. And then there are a couple medications and all over the counter to kind of help with constipation. One would be Dulcolax or Colace stool softeners, and the other would be miralax. They work in different ways. Miralax is a bulking agent. The stool softeners, they soften the stool. So you can take both of those whenever you want to after the operation to help with that. Probiotics are always great to continue. That kind of help you keep regular as well. If you are still having issues with constipation, despite the miralax and the Colace, typically then we'll do the magnesia products, and that's milk of magnesia or magnesium citrate. They will get you going. They unfortunately cramp the stomach when they get you going, but they usually take care of it for some people. The most extreme would be doing something like a Fleet's enema or something like that, but very rarely do patients have to go down that route. Usually the first couple medications will help them through it. So that's typically what I'd suggest for constipation post-operatively. It's a very common side effect of those narcotics, but usually very temporary. As soon as you're off the narcotics and using some of these other modalities, that'll help you get through it. And then once you have a couple bowel movements, then you'll get regular from there on out. So again, constipation, not super comfortable to talk about, but it is an important part of your post-op course, an important thing to understand for how you treat that.